Hi, Dr. Don Hayes, DC here for EndFlame. If you watched my first EndFlame video, you know that EndFlame is a patient-administered at-home fingerstick blood test that all chiropractors can use. The test itself determines the existence and the extent of a fatty acid deficiency that correlates with inflammatory cytokines in the blood that occur due to injuries, toxins, and/or pathogens. This video is designed to show you how to implement the EndFlame program into your practice. Now, if you haven't viewed my first video, please do so. It can be found on my YouTube channel. Just check it out. Now, it's important to know the difference between the EndFlame test and the EndFlame program. You see, EndFlame, the test, is simply a blood test that determines a patient's omega-3 index. Now, while that blood marker is tremendously important, it's not enough information to enable a practitioner to determine the optimal amount of pro-resolution nutrition each patient needs. Based on the genetics and biochemical diversity of each patient, along with Harvard's research, we now know that the key to optimal resolution of inflammation is the production of adequate levels of resolvins that are derived from the omega-3 fatty acids, EPA, and DHA. In contrast, the EndFlame program is a complete research-based omega-3 clinical service that you can offer in your practice. The program does use the EndFlame test to establish a therapeutic daily regime of extremely purified omega-3s and highly refined polyphenol supplements. Then after 90 days, the patient is scheduled to have a follow-up EndFlame test in order to gauge how their omega-3 blood levels are reacting to the recommended supplements. Based on that follow-up test, levels of EPA and DHA can be adjusted. Now, in order to implement the EndFlame program easily into your practice, you first need to educate patients on the benefits of taking the EndFlame blood test. To do so, use the EndFlame PowerPoint I created and either show it on your computer to each patient or print out each slide, put it into a flip chart binder, and review it manually. The EndFlame PowerPoint material will educate patients on the need for the test, and it will show them how you're going to use their blood test findings to tailor a treatment program to get the best outcome. Most patients will agree to a blood test with a lab report that objectively supports their care. And one of the most important protocols is to make sure you recommend the EndFlame program to all new and regular patients. The game-changing research from Harvard on why the test is so important is on my first video, so be sure to check it out. Also, reinforce to the patient the importance of immediately taking their test at home and sending it back to the lab in the pre-stamped envelope that's inside the kit. Also remind them that your treatment care depends on the results of the test. By the way, you must make sure you have your clinic email on the test request form on the line that reads email to receive results to make sure that you get the lab report. And when the email results come back from the lab, make 2 copies of the 3-page report, one for your records, and of course, one to give to the patient. Use the 1-page EndFlame program instruction sheet to prepare the patient's report of findings. I mean, all you're going to need is the patient's lab results and the EndFlame dosage chart. To determine the correct therapeutic dose of omega-3s using a patient's omega-3 index lab report, simply find the omega-3 index percentage number listed in the blue circle at the top of the omega-3 report. Now, if the patient has an omega-3 index of 7.34%, that percent will be listed as urgent on the dosage chart. The nutritional recommendations will read omega-3 Pro 850s, 6 capsules, 2 times a day, plus Greens First Pro polyphenols, 1 scoop, 1 times a day. Now, to determine a dosage using an omega-6 to omega-3 ratio report, again, look for the number in the blue circle at the top of the report. If the patient has a ratio of 4.3 to 1, which is urgent, look on the dosage chart to find the recommendation that says follow urgent omega-3 recommendations above, and consider as optional to add Acid Neutralizer Pro 1 scoop once a day. Always use the most severe finding between the two tests to determine the best dosage to recommend. In closing, always keep in mind that a healthcare practitioner is the only one capable of recommending the proper dosage of supplements for a patient. Now, if you have any questions, contact your EndFlame rep at Meyer DC by calling 800-472-4221, extension 5087. This is Dr. Don Hayes saying, thanks so much for watching. Hey, I'll see you next time. Bye for now.